control at the mammographic units. We are trying to define a level at implementation, just as a middle level. We have some available resources, economic, infrastructure, and human, and we have an epidemiologic pattern with a high incidence in breast cancer in all the region. We plan the staged presentation. We have just finished, and we have a poster. Yesterday we presented the staged presentation, early breast cancer in Uruguay, and we are now defining the pilot program. We will try, in order to make this pilot program, to identify and invite the target population, invited to a specialized screening unit, which can be hospitalized-based, mobile, or permanently based in other location. We will try to re-adequate the available mammograms screening unit across the country, taking the mobile ones and taking them to the region where the people cannot access easily, as it were, in the capital city. If clinically or mammographically an abnormality will be detected, there must be an organized structure that allows to drive the patient to a referral center. We must have a reliable pathologic report and an adequate data registry, the informatics system and data analysis equipment suitable for diagnosis and follow-up, and to define a national database that would let us an easy and rapid access to the collected information. We will try to find the easy access to the public and private information coming from the mammographic units dealing with the above-mentioned breast cancer pilot program. And we will try to get a high rate of women participating in the program, minimally 40 or 45%, ideally 70%. We think it won't be possible at the beginning. They must understand that their participation is the clue for the success of the program, and we will try to implement motivational techniques through the media, personal invitation, and public activities. All cases will be recalled and will be reviewed by the team immediately before the start of the assessment clinic to inform the team about the assessment procedures are required. And women attending this assessment must be told of their assessment outcome and receive clear details of any further appointments and when and how they will receive their results before leaving the assessment clinic. Of course, we will try to define appropriate rates from recall, participation, imagenology techniques, benign and malignant biopsy, breast cancer detection, and interval tumors. So the first step, we designed a simple data sheet for collecting information, filiatory data, pathological information, staged according to the 6th TNM edition in between July and December 2009, and the forms were received through the broad national network, the oncology network, during a 6-month period, and double-check data as to assure a better collection. And these are our results. The final data showed 11% stage 0, 41% stage 1, 21% stage 2, 18% stage 3, and 7% stage 4. Although women coming from the public area in our country were usually staged at a slightly more advanced stage, the vast majority of the population presented at early stage, as you can see here, 74% stage 0, 1, and 2, both in the public and private areas. Thus, we conclude that implementing a pilot breast cancer screening program is worthy for Uruguay. These are our human resources. General surgeons, 442, pathologists, 60, other surgery specialties, gynecologists, urologists, dermatologists, plastic surgeon, 1,000, radiation oncologists, 44, hematologists, 99, and medical oncologists, 105. All of them coming from the academic area, the university, the Hospital de Clínicas, where we train a program since, as you realize, 1987, more than 20 years ago. This was the distribution. Our country is divided in 19 regions. This is Montevideo, the capital city, a very small part of our country. And in 1987, we only had medical oncologists in green in 3 departments, as you realize. In yellow was the radiotherapeutica units, only in 4 or 5 places. Since the academic area, university, and training people, in 2009, it means more than 20 years after, Uruguay is completely full with medical oncologists. We have no place in our country without medical oncologists. And we still have radiotherapeutic areas in 4 or 5 strategic states. Thank you very much. This is mainly, you have to thank Dr. Muse. He was our professor at the University and Hospital de Clínicas Uruguay. What is our available technology? We have 60 mammograph units in our country, half in Montevideo and half in the rest of the country. We have 18 computerized axial tomography in Montevideo and 14 in the rest of the country, only 4 magnetic nuclear resonance, all of them in Montevideo, and gamma scanner 9 and 2, and PET-CT only 2 that they have just been launched in our country, and we are now our first experience we are trying with PET-CT. We had no PET-CT in our country till this year. We also have main technological facilities available, as you realize, macroarrays, DNA sequencing, proteomics, analytic biochemistry, mass spectrometry, recombinant protein technologies, protein biophysics, protein crystallography, flow cytometry, etc. We are working together with the Pasteur Institute in Montevideo. We have a filial of the Institut Pasteur in Montevideo, and the Institute of Biological Research Clemente Estable, that we are collaborating institutions with the Clinical Hospital, the University Academic, and the National Cancer Institute Hospital. We also have available equipment for microarrays, as you realize here, the bioinformatic unit. So we really think that Uruguay is a country able to work on a protocol based on a national level. This is our National Cancer Institute in Uruguay that was recently launched when you realize September 2009, when Tabaré Vázquez was our president at the time. This is part of our group working together, medical oncologists, radiotherapeutic oncologists, statisticians, epidemiologists, administrative pathologists, lots of people working with us. And this is our complete group now in the beach in the south part, in a very, very beautiful seaside resort in Uruguay, should you happen to visit, Punta del Este. Thank you very much.